why would we go 30 to 40 years of our life without estrogen?
So many women have told me personal stories where they went in, they told their doctor what was going on.
Their doctors got scared because what they were hearing in the media was...
Here we go. Ready? Welcome to Hormones Uncorked.
Yay! First
Maybe.
podcast. Whoa!
That was exciting.
Pop
that was a
that
good
top.
pop.
Cheers. Okay.
Delicious.
Hi, everyone.
This is officially our first podcast together.
We are so excited. And I
So
know you all have
excited.
been waiting like on pins and needles for this. So here we are.
Here we are. Welcome.
Hormones Uncorked, where we can drink wine and have a chat about all things hormone related.
So I think we should start off by introducing ourselves. I am Andrea Anderson. I am a nurse practitioner and the owner and founder of Ritual Aesthetics and Wellness. And so in my practice, we do all kinds of aesthetic treatments as well as wellness, because we deeply believe that it doesn't matter how great you look on the outside if you don't look and feel your best.
Right.
Sorry, feel your best.
Feel your best, yes.
Yes.
And your personal life?
Oh, well.
She always forgets this part.
Well, I thought this was business. Okay,
Oh,
so
no.
I'm married. I have a wonderful husband, Travis. Next year will be 10 years of marriage, which is exciting. And then I have two boys. I have a 13-year-old and a 6-year-old and 2 golden retrievers. And yeah, born and raised in Reno, Nevada.
And she's killing it. She's a boss right now.
Thank you.
And I'm Stacy Dooley, and I am also a nurse practitioner. I have been for 16 years, and I work at Pinnacle Medical Group in primary care. Recently, I opened my own online practice doing women's health, hormones, and weight loss, and it's going super well. I am also married to my husband, Dan, of 15 years this year.
Oh, yeah.
And 3 kids, Paige, Levi, and Quinn, 2 golden retrievers, and a very old lab. So that is our intro and our little lives. We'll get started with Hormones Uncorked. I think how Andrea and I are going to set this up is we're just going to go over a lot of information today. A lot of stuff from The Future is Female. We had some amazing feedback from all of you ladies. And so we wanted to put a podcast out there to kind of deep dive into the information. But this podcast will be an overview of all of the information. And then in weeks coming, we will hopefully have some specialists that will come on with us and a lot more information for you as well.
And we welcome any questions. I think that's, time and time again, as much as we think that so many people are now exposed to hormones and understanding a little bit more about it, we still get so many questions daily. So feel free to reach out, and then we will answer all those to the best of our ability. So
we are hopefully going to have Hormones Uncorked have their own Instagram page, which is going to be amazing once we can, set that up. So you can reach out Hormones Uncorked on Instagram as well.
Okay, so let's get started. We're basically going to talk about what we talked about at Future is Female because we found that was kind of new information for a lot of people. And so we are going to start with why there is so much fear around hormones in the first place, right? I think we all grew up hearing that, oh yeah, you're going to have menopause, you'll have hot flashes, and that's pretty much the gist of what we knew about it. And it is so much more than that. And then also I think the old way of thinking was, oh no, you can't have hormone replacements because you'll get cancer. And so we want to really dive in really quickly to where that even came from in the first place.
Right. So I guess in my practice, and Andrea knows this because she was with me for several months, we keep on having to educate women about the same thing about hormones. And women are coming saying, I have all of these symptoms, but I was told by my provider I can't be on hormones because it will cause cancer. And that's just not true. That is very much the old way of thinking. That was based off one study in 2002. And the media took this study and very much sensationalized it. So it provoked fear in so many people for so long. It set women's health back an entire generation. So it's very sad what it did. So we're here to kind of tell you about that study and why it's just not accurate.
Right. So this study was called the Women's Health Initiative, and it was in 2002, so a while ago. And basically, they took a bunch of women and gave them synthetic estrogens and progestins. And not only were these women postmenopausal, many of them had been without hormones for over 10 years, right? There was also a lot of comorbidities that they had. They had some heart problems, they had smoking. It wasn't an ideal group of patients to do this test on. So they have since retracted a lot of the things that they came out with. And why don't you talk about that a little bit?
So the average age of this study was 63 and a half, and really you're only supposed to initiate hormone replacement therapy about 8 years post-menopause at the most. They also did oral estrogen, and it was oral equine estrogen, which I just found out has like 21 different types of estrogen in it. So we don't do that anymore. Not only do we really not do oral anymore, but we do bioidentical estrogen, so it works with your own body. And then it was synthetic progestin. So the two of those together just made for a very flawed outcome. So in this study, it pretty much said that I think there was 16,000 women in the study, and 320 of them developed breast cancer in the group that was on estrogen, and like 280 developed breast cancer in the group that was a placebo. So there wasn't much of a difference in the two groups, but because of the group that developed breast cancer, the 300 people, they completely just stopped the study. They didn't put in the benefits that they were seeing of cardiovascular disease and anything like that in the study. They just stopped the study, saying that it was bad and everybody was getting cancer.
And so the trickle down effect of that was that they halted all studies. They stopped teaching about it in medical schools. And so there was really a huge gap in knowledge, and that has continued until recently, unfortunately.
And even the women that were on hormones were taken off of their hormones because their doctors got scared, because what they were hearing in the media was, this is going to make your patients have breast cancer, take them all off of it. So it was very sad.
And the interesting thing about that is when you look at the data rates, even with that decline in hormones, the breast cancer rates are still continuing to climb. And so even without that, we still had increases in breast cancer cases. So it was not the estrogen.
No, it was not the estrogen. There's been, I think they said, an 80% reduction in the amount of HRT, which is hormone replacement therapy. You'll hear us talking about HRT a lot since that study, but there's been like an 80 or 90% increase in breast cancer. So there's obviously not a correlation.
Right. The other thing that I think is important to talk about is the fact that women weren't included in clinical trials, or they weren't mandated to be included in clinical trials until 1993. And so that means all of the clinical studies that were being done were predominantly done on men. And I think we all can agree that men and women's bodies work completely differently. And so it's not apples to apples, right? And so that's really unfortunate as well, because a lot of the things about women's bodies were just unknown and unstudied until recently. And when you do clinical studies and trials, it takes a long time to publish that data as well.
Yeah, it should be like 10 years, and this was halted so quickly. So our next slide shows that 23 years ago was just a very long time. We have Justin and Brittany were still together. And it's just a really funny slide about we were still wearing double camis, girls, with a whole bunch of necklaces. So yeah, it was a while ago.
The Nokia, the little Nokia phone.
I mean, we lived it. We were there.
There was iPods.
Oh yeah.
I mean, iPods didn't go away until
but the shuffle was so amazing.
Yeah, it was. But it was a long time ago. And so, we're not doing any of those things, right? Anna Nicole was, doing her thing.
Her daughter looks just like her. I know. That's very sad.
I know. But yeah, so we're not doing any of those things. So why are we still adhering to the medicine that was from that time? It just doesn't make any sense. So we feel like it's important to differentiate between perimenopause and menopause and the differences between the two, because they're not interchangeable words, right? There is a difference.
I think that when we were younger, like Andrea was saying earlier, we heard the word menopause and we think, oh, well, we're going to be fine. And then we're going to hit 50 or 51. 51 and a half is the average age of menopause. And we're going to go through menopause and it's going to suck for like a year and then we'll be fine. Well, that's not what's happening. We go into menopause between the ages of about 47 on the average and 55, but we go into perimenopause 8 to 10 years prior to that. So we are missing an entire 20 years of our life where our estrogen is starting to deplete and our progesterone, and we are not feeling well. So the difference between perimenopause, it is that time before menopause hits, where you start to have a decline in estrogen. Your pituitary stops telling your ovaries to release an egg, and so there's a decline. And then menopause is you haven't had a menstrual cycle for 1 full year, and that means that you're in full menopause.
And I think there's a lot of misinformation around menopause and perimenopause. I think women don't anticipate that they're going to experience any changes until they hit menopause, right? But really, the changes are in the perimenopause portion of life. And we talk a lot about how much it is such a catastrophic event for your brain and your body because your hormone levels are just fluctuating so much, right? So 1 month, and this is why labs are difficult during this time, like 1 month, right? You can be closer to normal estrogen range. And then the next month it goes way down. And so our brains do not like that, unstable flow of hormones. And so it can be really hard on the body, really hard on the mind. And it's essentially like being PMS for 10 years.
That's where the fatigue comes from. Your brain is trying so hard to tell your body to release an egg, and there's just no more eggs to be released. And so it's literally a catastrophic event for your entire body, but your brain is first. And so that's where the massive fatigue comes in, is just your brain saying, oh my gosh, I'm trying to do this, but it's not working. And so you're feeling just absolutely shitty.
Yeah.
I like the word shit too, so I use it a lot. Sorry.
Yeah. And, I think too, there's so many symptoms from loss of estrogen. You have estrogen receptors everywhere in your body pretty much. And so you may be experiencing symptoms and you don't realize what's happening. You don't realize, I was a nurse. I wasn't a nurse practitioner when this happened to me. And my thought was that I had cancer. Luckily, I did not have cancer, but for me to go to
we went down the cancer rabbit hole for a while.
To go to such an extreme,
you felt
it
so
was
shitty.
Fatigue, night sweats, horrible joint pain, my hair falling out. I'm like, something is really wrong. And it did not occur to me that I was perimenopausal.
Well, we also weren't educated around it, right?
Right.
So I think that we can't fault the physicians that aren't very versed on this because we didn't have the education in nursing school, nurse practitioning school, PA school, or medical school. But I do feel like when all of this new information is coming out and, a lot of the physicians are still saying, no, we don't do hormones, it's still hard to understand why. So, that gateway or that gatekeeping is where we want to break the mold and inform all of you of what you should be asking for and you should be getting.
So where to start? There's a lot of different avenues on ways to get help for perimenopausal symptoms. And we don't recommend just jumping right to medications, right? That's only a part of the puzzle. So we obviously recommend drawing labs, and ideally we like to do that at day 3 of your cycle or day 21. If you have a cycle, right?
Ideally, it would be both, but if you could do one, I would say day 3 for sure. But if you have an IUD, then we just don't know, or a hysterectomy, you can just do it whenever in your cycle.
Right. And then, some people will say, well, Andrea, I had my labs drawn and it was fine. It was normal. And that might be true because it might be a month where your body is able to kickstart it enough to get that estrogen a little bit closer to normal. And so don't be discouraged if you've had labs and they've said, yeah, you're okay. Are you optimized though, is the question. And so a lot of the time we go off symptomatology, not just lab values. And that's important to think about. Also, we really want to make sure that people are getting their supplements, right? Can we talk about cortisol?
Yes. So cortisol's all the rage right now, right? Like cortisol, TikTok, manage your cortisol levels and you'll feel better. Well, your cortisol is going to be super messed up when you're in perimenopause because your estrogen is declining. When your estrogen is declining, then your body kind of goes into an internal fight or flight. And so I really feel like all of the influencers or TikTok that's talking about cortisol, it's very much relating to perimenopause as well. You can't have perfect cortisol levels unless you are on the beach and have zero stressors in your life. Your cortisol changes all of the time, up and down. You almost get in an accident, your cortisol spikes. You know, your kids start screaming at each other, your cortisol spikes. So it's kind of up and down all the time. But to keep it stable, you can do some supplements like Cortisol Manager is a great supplement that you can take at night. There's an adrenal complex supplement you can take in the morning to kind of wake your body up and get your adrenal glands moving and your cortisol circadian rhythm back in order. So there's definitely things you can do for your cortisol: eating right, exercising, sleeping, you know, all the things they tell us to do so that we can have optimal cortisol levels.
Probably limiting.
Oh, and not drinking, but this is our podcast name. So a glass of wine ain't going to kill no one.
Right. So when we are looking at medications, right, the three that you mainly hear about is estrogen, progesterone, and testosterone. Mm-hmm. And I think, again, it's important to kind of share the difference between bioidentical versus synthetic and break down kind of what how the three of them interact together and why it's important for women to have testosterone even. Because I think a lot of women think, what, testosterone?
Yeah, I'll talk about the estrogen, progesterone. I'll let Andrea talk about the testosterone since it's, you know, she loves it.
I do. I really do.
So estrogen can come in a patch, a cream, pellets. We do not recommend pellets, just for the record, or pills, which we also don't recommend oral pills. Neither do Andrea nor I do in our practices. The best, in my opinion, is going to be the estrogen patch. It is a transdermal patch that you apply once or twice a week. Usually it's twice a week, to your backside or your lower abdomen, and it delivers a bioidentical amount of estrogen throughout 3 days, and then you change your patch. That bypasses your liver. So for some people that have a predisposition to clotting, I personally have had a blood clot. I had a pulmonary embolism when I was 21 and was told I could never be on hormones. That was a very sad day because I just thought, oh, there's nothing I can do about it. But this transdermal patch is life-changing. So it bypasses your liver, so we don't increase your risk of clotting, right? So we don't increase your risk of stroke. If you have your uterus, you have to be on progesterone. And this is also bioidentical progesterone. So you take that every night. It helps you sleep. It helps balance out your estrogen so we don't get an increase of endometrial lining, which can cause endometrial cancer. So we have to be very careful about balancing your estrogen and your progesterone levels. I'm also not a big fan of the cream. I know some people are, but I don't feel like it's a steady state delivery method because you can absorb some one day and not the next day. So we have to really watch with that estrogen to be balanced out. Now, if you've had a hysterectomy, you don't need estrogen, but a lot of people, their biggest complaint for perimenopause, I feel like I'm bending over.
Well, you can bring it.
Their biggest complaint for perimenopause and menopause is insomnia. I know, I'm just like going to it, like following the microphone, is insomnia. So that progesterone works like a little magic pill.
Yeah, progesterone's amazing.
Progesterone's amazing.
It really is because it's your like chill hormone, right?
It's your nature Xanax.
It's your nature Xanax. And so many women will come in and right in my industry, right, I'm injecting faces primarily all day long, every day. And when
that's a plug. You should definitely see her to get your face injected. She does the best.
Thank
Don't
you.
look at my forehead. I haven't had Botox in 4 months.
It's okay. We'll get you fixed up.
Go on.
But you know, I talk to women all day long and so many of them are saying the exact same thing. And sleep is a huge one. And we know the importance of sleep. We all know that we have to have good sleep. And yet we're trying all of these different things. And sometimes it's as simple as adding progesterone. And that's not something that a lot of women think of. They think, you know, melatonin, you know, cortisol cortisol drinks.
Oh, it must be my cortisol. Once again, it must be my cortisol.
Yes.
Yeah.
And I think that's just because there's more of awareness around cortisol now, which is great. But progesterone is also magical for sleep.
Let's go back to talking about some supplements too. Well, you can add supplements in here while we talk about it. If you're in perimenopause or menopause, you definitely want to add magnesium.
Yes.
Because progesterone and magnesium together are amazing. If you want to add cortisol manager as well, I love it, but that's also an option.
We prefer magnesium glycinate.
Yeah,
right?
magnesium. There's a lot of different types of magnesium, but make sure you get the right one so you're not running to the bathroom all day.
Yes, for sure. Mag citrate is not the one.
No.
Not the one. Unless you need to go to the
Unless
bathroom.
you need to go to the bathroom.
Yeah. And then also vitamin D. Vitamin D is so crucial. And it is actually a hormone. People don't think of it as a hormone, but it is. It's a fat-soluble vitamin. And the majority of us are actually low in vitamin D. Part of that has to do with our ability to absorb it, right? Because of how far away we are from the equator. And so, you know, it's not included in normal labs. It's really not. And if you try to get a vitamin D drawn, your insurance will likely not pay for it, right?
Especially if you're Medicare, they will not pay for it. It's $300.
Yeah.
But most commercial insurances, if you code it correctly, will, but Medicare, definitely not.
Yeah. And in our practice, we have found a really cool way of addressing this is that we draw our labs in-house and we send them out and we get our results back in like 2 days. But it's significantly less expensive and we just bundle that in with our hormones because it is an important one to check. But all that to say, vitamin D supplements daily. We like the sublingual dropper, the vitamin D and K2.
And K2 together. I'm not going to give doses because then that's prescribing, I think. I don't know.
This is not medical advice. This is just our opinion.
We should have probably said at the beginning. But we are right. So there's that.
All right. So let's talk about testosterone because we didn't talk about that.
Yeah, your turn to talk about testosterone.
Okay.
You're on this one.
Yeah. And I think a lot of women are afraid of testosterone because you hear about, you know, growing hair and balding and being manly. And that can happen for sure.
And acne and anger.
Anger. Thank you. That can happen if you are dosed incorrectly. And I think that personally, when you see that the most, it's typically with a pellet or even shots. When you say
some women are getting some shots online and they like them. It's not my prescribed practice, but
yeah, I mean, it makes you feel great, right? You're so tired for so long, and then you have something that helps you get energy, helps you build muscle mass, but it's a moderation type of thing. We're not suggesting by any means that you jack your testosterone up. No, you just bring it back to a normal level so that you're not feeling like you are going to fall asleep in the middle of the day, every single day. And it's wonderful. It helps with the muscle mass that is so important for keeping you strong, and longevity is a big piece of muscle mass and bone health, right? And so I'm a big fan of testosterone, but we recommend a cream formulation, compounded, and you just apply it after you get out of the shower. I like to put it on my thighs and then wash my hands and off you go. It absorbs fully in like 2 hours. So of course you don't want anyone else to touch it for 2 hours, or you don't want to go swimming, but after that you're good to go.
Yeah. I've also been starting to prescribe just like a pea-sized dose of androgel, and I feel like that's been helping a lot as well. So you don't have to use as much and you still get, you know, the 5-ish milligrams, which is kind of like the max that we do is 5-ish milligrams. Maybe up to 10, but it just depends on the person. You can get too much testosterone and you can have an elevation in your hemoglobin hematocrit. So it can increase your risk of clotting. So it's super important that you know your provider who's prescribing it for you and monitoring it.
Yes. So that is obviously a very scary part of it, right? We're not wanting somebody to have heart attacks or strokes.
We don't usually see that with compounded though. With the low dose we do.
No. It's more the shots, and the pellets.
Yeah.
And that's why we're not a fan of those. And I think the other thing that I want to discuss with the cream and how it's different is when you put a pellet in, it's there and there's no way to get it out. And so depending on how your body metabolizes things, you may have your testosterone skyrocket, right?
You're going to be a man. That shit's staying in there.
Yeah. And then, you have changes, like you said, in hemoglobin, hematocrit. It's putting you at risk for some scary things, and you can't get it out. There's nothing to do about it. So,
And that laser hair removal is bye-bye.
Yeah.
Because it's growing back too.
Yeah. So that's not ideal. And then the shots you think are a little bit more ideal. That said, they still have peaks and troughs, right? And so you're going to get your shot, you're going to feel great, and then it's going to go down, and then you get your shot. And so you're just up and down, up and down. And to me, I just don't think that that's ideal either. It's very simple to put a cream on.
Very simple. Every morning, put your cream on, slap your cream on. Just don't let your babies touch it.
Yep.
Do you want more wine before we go on?
I'm the only one drinking.
No, I did too. Hi.
I didn't see you take a sip.
It's gone.
You're right, it is gone.
You've just been talking.
I didn't see you drink it.
Less talking, more drinking. Just kidding. But I'm not. Okay.
Okay. So I think we should discuss the benefits of hormone replacement therapy because, you hear a lot about the breast cancer situation, right? Like, oh, this is a fear. This is a fear. Yes. But you are much more likely to suffer a heart attack or get Alzheimer's or have debilitating osteoporosis and fracture a hip, which is one of the main
Yeah, I always tell my
killers.
patients that I'm so scared that I'm going to, fall and break a hip, end up in a nursing home, and then get pneumonia and die because we see it all the time.
all the time.
And you're probably thinking, no, you don't. Yes, we do. And we also see urosepsis. We see UTIs all the time because once you lose your estrogen, you don't feel a UTI anymore. When you're like younger, like I'm going to say that we're young because we kind of are, but you can feel a UTI coming on. It hurts. Right. You don't feel that when you get older. So you get in a lot of trouble, and women get in a lot of trouble very easily. So major cause of death, urosepsis. Yeah, so we talked about the patch, we talked about progesterone, we talked about testosterone. DHEA is also a backer to your hormones, so that's something that is a supplement that you might want to look into as well. I have personally never taken it, but I have a lot of patients that like it.
And it's a precursor. Like it helps you naturally make more testosterone on your own. Mm-hmm. So, sorry.
So I know a lot of the online pharmacies do that.
Yeah.
But I don't know how great it is. But vaginal estrogen, so estrase vaginal cream, that will help with lubrication. It will help prevent UTIs because it helps with lubrication down there so you can get rid of the bacteria easier. And it helps with, sexual dysfunction, excoriation, which is like a dryness of your skin down there. Everything gets drier when you go through menopause. We don't want it to be dry.
No.
And I don't want to use the word because I don't like it.
The M word?
We want it to be
like
moist.
the cake? You said it.
Just like a cake. I know. Now I'm embarrassed. I can't. Go ahead.
You're
Go to the
getting
next
pink.
subject. So bad.
Additionally, I want to mention, because I'm in the beauty world, of course, right? But our skin changes so much during this time. And so, yes, you can supplement with patch or cream or however you want to do it. But they also have compounding pharmacies where there is topical estrogen that we can put on the face. And so we can
Have
send...
you tried it yet?
No.
I haven't either, and I really want to.
I want to too, and
But I
keep
heard it can make like your melasma
worse.
spots worse. Yeah.
I don't have melasma, so...
I have a little bit. You're such an asshole. She's an asshole. She is. I love her, but she's an asshole.
Thanks.
Okay,
I
moving
work
on.
hard for this skin, I gotta say. Okay. So,
You better not have melasma. You're in the industry.
I know.
Yeah.
I know. I have access to everything, so I don't have an excuse.
I told Andrea that I skin pinned myself without numbing cream, and she almost died. I only got as far as my forehead.
Yeah, what?
It was
were you
horrible. It was
thinking?
very painful.
Which is so silly because when you numb, it's like, doesn't feel like anything. It feels like maybe a little bit of sandpaper or something.
I was just like going for it, and I was like crying by the time I got past my forehead, and I was like, I'm done. Okay. So now I'm peeling with tears.
It's okay. You can't tell.
I know.
Looks
It's true.
good.
Okay, moving on. When can you expect to feel better? So I tell my patients that 3 months. I say 3 months. So if we start you at like a middle of the line estrogen patch, or we see where your labs are and we kind of figure out a plan for you, about 3 months is where we want to follow up and see how you're doing and tweak your medications if we need to. So it's definitely a marathon. It's not a sprint. This is you got to work with your provider and see what works best for you. So in my opinion, it's about 3 full months. You will start sleeping better in the first couple days.
Yeah,
for sure.
And in fact, you'll probably feel really kind of groggy and tired in the morning for a couple weeks, wouldn't you say? Yeah. But it gets better. And then
it gets better. And once you're there, once you're in the sweet spot, then you can stay there. And if you've started hormone replacement therapy early enough, then you can stay on it. There's no reason to discontinue it because your body is now stable and used to these hormones, right? And actually the research is if you start HRT early enough, especially estrogen, it can be breast protective, GI protective, like we talked about, bone, heart, I mean, everything. We have estrogen everywhere, like Andrea said. So it's just it's us trying to really look out for ourselves later in life.
Yeah. And slowly you can taper off when the time is right, instead of just this violent drop when we're still so young and vital. And like, yeah, we're not having babies anymore, but we don't want to just lose all of our vitality and feel like absolute shit and then be brittle. Like that's basically what it is. You just become like this brittle, frail situation.
I mean, I think that
that's how I felt anyway.
Yeah, you feel old. I was telling a patient that, within the first week I would step out of bed and like the little joint pain went away, you know? And I was like, this is incredible. I love this. Back in the day, we weren't supposed to live past 40, right? That was like the average age. So now when the average life expectancy is 78 or 80 in women, why would we go 30 to 40 years of our life without estrogen? I mean, crazy. Men can walk in and get testosterone replaced whenever they want to, but why do we have to fight so hard as women to get one of our most important hormones in our entire body replaced?
Right.
We have it our entire life until we're 40, 50 and it starts to peter out. So why do we have to beg to get that replaced?
Yeah. And it is doing everybody such a disservice because, like we said, it just sets you up for failure and so many other comorbidities that can come along with that. And it's really a shame. And so that's why we're passionate about kind of spreading the word, educating, interviewing other experts, answering questions, and just being your girlfriend, your nurse practitioner girlfriend.
Yeah. And I think that, Andrea and I have come together for a long time. And we've said, she has her practice, I have my practice, but this isn't for us to say, come to our practice, come to my practice. I mean, we both do it. So if you want a resource, that's something, but get help where you can get help. Like if your gynecologist will prescribe it, go to your GYN. If you have, a family practice practitioner that will prescribe it, see them. Like you just get help where you can, because there's no reason to suffer in silence. Like there's no reason to just be out, saying, oh my gosh, Stacy and Andrea are right. And this is happening to me, but like nobody's going to help. If they're not willing to help you, we are.
I've had so many people say like, do you know a good primary care provider? I just can't find somebody I like. I can't get in. I can't find anybody to listen to me. So many women have told me personal stories where they went in, they told their doctor what was going on, and they were basically gaslit through it. Like, well, this is just part of being a woman. You'll get used to it. Yeah, like basically you're being dramatic. It's in your head. All kinds of things that we've heard. And it's unfortunate, right? And it is hard to find good providers and people that will work with you. And so that's our goal.
And I think that we're not treating the root cause. Like women are coming in saying, Andrea's list of symptoms she had earlier, my list of symptoms, and you're being put on a medication for sleep. You're being put on an antidepressant. You're being put on, something for your skin. You're being put on. And so we're putting people on all these medications when one or a couple medications can actually fix the problem and not just put a Band-Aid on what's going on. Right. So
something else that I read and I found really interesting and kind of disturbing is that you can't patent a medication if it's naturally occurring in the body. And
that's interesting.
And we'll have to do some research if this is accurate or not, but I've read it a couple times and I've heard a couple different people say it. And so like NAD, for instance, right? NAD is naturally occurring in the body. And so it's not going to become a prescription drug unless they change it in some way. And, you have to wonder like, motives, right? Like, if it's not a big money maker, sometimes, anyway, I'm going down a rabbit hole there.
We can keep on going down rabbit holes. We love this stuff so much. I understand what you were trying to say.
Yeah, you get what I'm putting down.
I'm reading through the lines.
Well, that's why. So the book that I read, and I'll have to.
We're going back to it now.
Remember,
we were not
I know.
Go back
you
to
know,
it.
I'm a Gemini, and I I beat the horses after they're dead.
Yep. Go ahead, beat that horse. Okay. Compose yourself.
Okay.
No, go. Let's hear it.
So basically, what they were saying is that, well, if estrogen is all harvested the same way, right? It's like from soybeans or whatever, but we were getting synthetic estrogens. Like, why?
Horse urine.
What were they doing? They were changing it.
Well, there was 21 different types of estrogen in this one.
Well, the horse urine, right?
Yeah.
But the one that was like from soybeans or whatever, it was from.
Yeah, I know which one you're talking about. I don't forget the name.
But they were altering it to make it a prescription medication so that they could patent it instead of just giving it in its bioidentical form.
Or, I mean, also, we didn't even talk about this, but also like looking at what foods feed your estrogen at different times of the month, right? Like if you can actually eat certain foods that will feed your hormones. So if you're very reluctant to hormone therapy, like you can look into dietary stuff that will help your hormones. Now, it's not going to help it great. It's not going to be 100%. It's not going to be medication. But if you're like you have an aversion to medication, look at foods. I mean, we know yams, we know soy, those are all estrogen and then progesterone based. So there's things you can do for that as well.
And anti-inflammatory diet, right? There's a lot of different methods, and there's great books out there that we can start recommending in future episodes and talk about. There's not one approach. And while this has been a heavy conversation around hormone replacement therapy, there is a lot of other things that you can do as well.
Yeah. And there's also not one size fits all. If you go to somebody and they say, we give everybody this, that's not true. Everybody is different. Their chemistry, their past medical history. So just kind of looking at the individual, which is something that we definitely do. And I say this all the time, but honestly, just listening. All you have to do is listen to people because people know their bodies.
They do. And and that is the biggest thing. And that is what everybody has said to me about you as their primary care provider is she takes her time. She listens to me. I feel seen. I feel heard. I feel safe. I feel well cared for. And that's amazing. I wish every patient felt that way when they left their primary care provider's office. But
thank you. Yeah.
Also, it's a hard, medicine is hard.
Medicine is very hard right now. Yeah. So we're trying to educate you. We're trying to do the best we can. We are not trying to promote anything specific except for get your help. And if you can't get help from somebody, just know that we are resources you can turn to. I think we're going to be on Instagram. Like I said, we are going to be on Spotify and YouTube. And so Andrea has her website. I have my website. We have individual Instagram, but we also will have this Instagram together.
Yes.
As one big happy family with our Hormone Uncorked people. So we don't know how often we're going to put out these podcasts, maybe every 2 weeks.
We're both working a lot right now. And yes, our goal is to be consistent but it's not going to be a weekly thing, but I think bi-weekly is probably appropriate.
Yeah. So we should have some specialists on hopefully in the next couple weeks. If you have questions, let us know, and maybe next episode we can cover questions. I know a lot of people had questions about the GLP-1s and hormones, and that is a completely full segment, so we can maybe get into that in the next couple weeks.
Yes, we love a GLP-1.
We love a GLP-1. So maybe the next segment, if that's what you guys want to hear, we can do that.
Why don't you tell them your website? My
website is very hard to remember. It's stacydooley.com. So that's me. And then my Instagram is at Stacia, Stacia Dooley.
Okay. Love that.
I know, right?
Stacia.
Well, I didn't mean to, but that's just how it happened.
I love calling her Stacia. That is her real name.
But if any of you call it to me, I will slap you in the face and unfollow you. I'm just joking.
I call her Stacia all the time. She hasn't slapped me yet. I think you're going to be all right. Okay. So my website is ritualrenonv.com. And I don't know what my Instagram handle is. I know there's
it's like at Andrea Ritual. I put it on YouTube last night.
Here, look, I do have my phone. We've been talking for 45 minutes.
Oh, wow.
I have like 4 Instagrams now. So I have Ritual Reno NV, which is my business. And then I have Andrea_Ritual Reno NV. So we would love if you would give us a follow and a shout out if you have any questions
Yes,
until
please
we
do.
get our...
What should be tomorrow or the next day? Because I'm going to work on this.
You're going to do it tonight? I was going to say you can message me on my...
Well, yeah, I mean, by the time this podcast is up, we'll have all hormones and
Oh, that's true. Yeah.
Sorry,
Not
we're just recording a couple of
instantaneous.
days. We forget that this isn't live because we don't do this. This isn't
This is our
MO.
first. This is not our MO, but I think this is okay for our first podcast.
Yeah, y'all like it, right? Thank you. Yes. All right. Well,
Okay.
cheers.
Cheers.
Everyone. Thank you for coming to our podcast.
Thanks for tuning in.
Bye-bye.